Welcome to our second half hour. In our last half hour, you met Suzanne Judd. She moved to Idaho recently to be near her grandchildren and her children. She started as a seamstress shop, but she isn't making any money yet. She is one of 78,000 Idahoans too poor for Obamacare and too young for Medicare and too wealthy for Medicaid. That's because Idaho does not have the expanded Medicaid to cover her, so she falls in the gap. Carol Honus asked her to make an appointment with the Health West and meet with a licensed enrollment counselor with 3 years experience. She's someone who helps people find an affordable insurance plan.
When we caught up with Suzanne, she'd already been told 3 times that she and her husband do not qualify for affordable insurance. Even though they've opened a new shop that isn't turning a profit yet, they are too rich for the Medicaid that exists in Idaho, too poor for regular insurance, and too young for Medicare.
I hear you're here to talk about insurance.
I am.
Okay, let's get started.
After crunching some numbers, the news for Suzanne was not good.
Because Idaho hasn't expanded our Medicaid program, it's leaving a lot of people, you included, that fall into what they call the coverage gap. People who make too little to qualify for the credits through the Affordable Care Act, but too much to qualify for Medicaid. So unfortunately, until we expand our Medicaid program, it's leaving very little insurance options.
Despite this fact, Suzanne is of the political belief that nothing is free. She is afraid, even though she needs the insurance, if Idaho expands Medicaid, it will be like her recent home state of Minnesota, where the taxes, she says, just keep going up and up.
Now in Minnesota, our taxes on our home went up every year by almost $100 because they cover everything. They just cover everything. And you're like, well, we're paying for that. We're paying and paying and paying.
Stephen Wegg says he's not surprised she feels that way. Minnesota is a very proactive state. The taxes are high there. That's been her experience.
I don't know that I would tell the lawmakers here to expand Medicaid, even though it probably would help me. I don't think it's good for the economy. I don't think it's good for our state. I don't know, even though it leaves me out.
But Wegg says the federal money is already set aside for Idaho to expand Medicaid. The state has it available for 10 years at no cost to the Idaho taxpayer. Right now, it's just being used by the 30 states that have expanded Medicaid.
Well, it's part of the federal debt. Well, the amount of money that the Idaho gets is about 1/1000% of the federal budget. So if our 1/1000 of, it's sort of like taking 1,000 balls. You take one out, what difference does it make? It's not like we're the one ball that causes everything to collapse. So we're a very, very tiny part of that whole budget process.
Suzanne isn't wrong to worry about starting a program with the federal government that will end in 10 years, and then Idaho has to keep it going on its own. Many Idaho leaders agree with her position. But Wegg says, look at the big picture.
I look at it this way. It's how we treat each other as human beings. What's our mark when we leave? Are we better off with helping each other out? B, we're a small business, small employer state. You can't do good business if you don't have good health. We don't need to have people risk bankruptcy.
Wegg says, as a society, we invest in our children's education. Few parents could afford K-12 private schools. He asks why Medicaid expansion is any different. It's not a handout, it's a hand up. And you're not on it forever. It is quite probable that this will be debated in the next legislative session.